Welcome to Core Physio and Pilates video series. I'm Lee and this is Lily. And today we're going to be going through a postnatal Pilates series of exercises. Lily hasn't just had a baby, but we're going to be using her as our model today. Firstly, congratulations on having your baby. If you haven't been back to the studio yet, these exercises are a perfect way to start getting your core and pelvic floor muscles working. If you've been back to class, well done, and still use these exercises to do when you have got time at home. So the first thing I'll talk about is the separation of the abdominal muscles. It's very common when you're pregnant to have a separation of the muscles that run down the front of the stomach. This is known as a dram, and it happens because of the stretching of the abdominal muscles with the growing baby. Things that I'd like you to notice at home is if you feel that when you're sitting up out of bed or rolling over, you see a doming of your tummy muscles, that means you may have a separation of these muscles. I urge you, if you do notice any bulging of those muscles or pushing out, puffing up of the belly, to see a physio at Core to assess if you have a dram so we can give you exercises to help repair that. It's really quite important. So the first exercise we're going to teach Lily is how to turn on your core muscles and your pelvic floor to get it strong post-birth. So lying on your back, please, Lily. This can be done not only lying on your back, but you can be doing sitting on a chair when you're feeding, lying in bed, sitting anytime. It doesn't always have to be lying on her back. So you're comfortable on your back here, Lily? Lovely. So the first thing I'll get you to do is bring your fingertips onto your hip bones. So find your hip bones and then bring them a little bit more internally. Lovely. So what I'd like you to do is focusing on a subtle squeeze of the pelvic floor muscles inwards and upwards. And underneath your fingers, you'll feel a little tightness. Can you feel something? Mm-hmm. Great. Holding it for as long as you can, which in the early stages might not be very long at all. And then once you've stopped feeling the contraction or you feel it release, you know that's your maximum. So what you're going to be feeling once again, Lily, is a tightening inside the vagina, a squeeze of lift in and up. In those early few weeks, you might not feel very much at all, but just getting the brain to still think about it is going to get those patterns working. So she's squeezing and lifting and holding for as long as she can, keeping on breathing as you're doing it. So a nice bit of advice is to count out loud while you're doing it so you don't hold your breath. So that's just a really nice exercise to do to start to turn on those pelvic floor muscles again after the birth. And particularly if you've had a vaginal delivery, even a cesarean, you still have the 9 months of pregnancy on that pelvic floor. And to help get your core muscles to start to return on. So now what we're going to do, Lily, is teach you another exercise specifically for these deep muscles. It's called bent knee fallout. So with your knees bent like they are, let's bring both hands onto your hips, Lily, to check if you're keeping still. So what you're going to do is you're going to let your right knee just fall out to the side without your left hip lifting up. So I'll get you to do a bad one so everyone can see. So you don't want the pelvis to roll like that. You want to keep that hip down the entire time. So take a breath in as you let the knee melt out to the side, turning on your core, so squeezing internally, and then bring the knee back in. It might be very small to begin with, and that's okay. It's not about the range, it's about keeping your stability. So you can do 5 or 10 on each side, nice and slowly. As you get stronger with your weeks postnatal, you'll be able to let that knee move out further and further and staying really still through the hips. So that's bent knee fallout. The next one is known as a knee float. So once again, turning on your pelvic floor, just keeping your knee bent and just float your right knee up to 90, keeping the rest of the body really relaxed. So the spine is relaxed and no movement, and then bringing it straight back down. That alone is going to be quite challenging those early weeks because you're really having to squeeze internally without very much strength in those stomach muscles. Good. An analogy is that if you imagine that you're lying potentially on eggshells, you don't want to crush any of those eggshells. Great. When you start to feel comfortable with that, we'll just give you one progression. It's going to be a knee float up. Then you're going to extend the leg towards maybe the wall opposite. You can go higher or lower. Lower's harder. Bringing the leg back with control. And down. Lovely. So once again, doing as many of those as you've got the time for. The lower back is an area that really needs to be moved again now that you've had the baby. We've been stuck in extension for so many months, so we want to try and regain what we call flexion. This is known as pelvic tilting. It can be done lying on the floor with your baby next to you, or at night, or sitting on a chair. So Lily, as you breathe out, you're going to flatten out your back by tipping your pelvis as if that bucket of water was just tipping over, feeling the back flattening out and then rolling just back to neutral. Feel okay? So we're just trying to regain some of that flexion into the spine, flattening out. You can once again use those core muscles, the pelvic floor, and the tummy will gently tighten and then slowly back to neutral. If you want to exaggerate the other direction as well, extension, you can do both. If it feels nice, you can just massage the back. So this is some kind of gentle massage for the lower back. Lovely. And then rest. That's called pelvic tilting and can be done lying or sitting on the chair. So your upper back gets very, very tight in those early months once you've had a baby. Whether you're feeding a baby with your breast or in a bottle, you're sitting, so your upper back gets very stiff. So we're now going to teach you a couple of exercises to help loosen your upper back. So please lie on your side, Lily. You'll need at least one firm pillow or two smaller pillows, making sure that her head, her back, her bottom, and bring your feet back, Lily, so they're in line with your bottom. Lovely. So this is called book opening. Straighten out your arms. Great. As she lifts her top arm up, she's going to take a nice breath in. And then as she breathes out, it's her rib cage and upper back that's going to bring that arm open. Her head can follow or it can stay relaxed forwards up to her. She stops when she starts to feel a lovely stretch because her hips have got to stay nice and still without rolling back. Great. And then bringing the arm back slowly. I really urge you to do this exercise at least 3 times a day in these early few months after having a baby. It will really prevent the upper back muscles from getting painful and the neck and upper back from getting sore and needing any kind of manual treatment. Lovely. If you want to add a half a kilo weight into your top arm, you can. One last one here, Lily. Lifting it up and then opening it out to the side and then bringing it back. Lovely. We'll just do one similar one called bow and arrow, where her top arm slides forward along the bottom arm first to get a lovely stretch through the shoulder blade here. And then bring the arm back, Lily, by sliding it, and then start to bend your elbow like you're pulling a bow, and then reach the elbow towards the floor behind you, trying to really open up her sternum and her thoracic upper back. Great. And then reaching forward. Does that feel okay? So there's a subtle difference here in what you're feeling, and you'll notice that if you just follow my cues and think about the elbow reaching back, keep your head relaxed. Reach, lovely. And coming back, and just relax. So I'm going to get you to sit up now, Lily. Another area that gets nice and tight after you've had a baby is your muscles at the front of the chest, the pectoral muscles. So just maybe turn to face that wall for me and bring your hands behind your back, interlace your fingers and bring your palms together and really open through the front of the chest. Good. Try and keep your ribs connected. And then lift, if that's enough of a stretch for you, you'll just hold that for as long as you can. Can you feel that, Lily? Not yet. If you want to make it more intense, you'll lift the arms away from your spine, intensifying that stretch. I'd like you to do this exercise, ladies, after every single feed of your baby. So that might be up to 10 times a day to really feel and open the front of the chest. And then bring the arms back down. And then relax. Turn to face the front. So there are a number of exercises that are fabulous for strengthening and stretching the upper back with a foam roller. If you have a foam roller at home, please refer to our foam roller video because that will show you how to open the upper back as well as strengthening it. Another thing to do is some self-massage through the muscles of the upper back. So with your hands, Lily, just bring your hands onto the upper shoulders and just really get in there with your fingers. There's no right or wrong. Finding the knots and just using your hands to really massage as often as you can during the day before it gets to painful levels. You can go right up into the neck as Lily is demonstrating. The other thing you can do is use a spiky or massage ball. So please refer to our spiky ball video for some exercises there. Keep up the great work and we look forward to seeing you in the studio soon.